Good morning, I'm Nikki. I'm Jacqueline.
I'm Gain.
And we're here to teach you about nutrition and hydration. So when we grow old, I don't know about you, if I grow old, so there are other changes in my body that will affect how or what I eat. So one of them will be that your teeth erode and your tooth loss happens. So who here has dentures? And can you tell me how hard it is to eat food without teeth, right? So of course your saliva production is reduced as well. So it makes it hard for your body to process and digest what you eat. And then your taste bud function decreases, so foods that you like as a kid or as an adult, it doesn't taste as yummy or delicious as it used to. And then of course the muscles along your digestive tract becomes weak. So what happens is your bowels does not move as smoothly as it does. And then of course your thirst and hunger sensations change. So sometimes you think you're full but you're not really. Or sometimes you can't even tell if you have to drink water or eat any snacks. And of course, less digestive enzymes are produced and your skin becomes thin. So you lose more water as you grow older. And of course, we also have some, when we get sick, there are other changes that we have. One of them is that your stomach is more sensitive to food, and then your changes in bowel pattern. There will be one day that you're struggling to have a bowel movement, and there will be days that you can have like 5 to 10 bathroom breaks. So you can also have some GI bleeding, which is kind of threatening. And then of course your weight loss and your weakness and fatigue. So what kind of illnesses are those? Ulcer, cancer of your intestine, your stomach or your liver, irritable bowel syndrome, Crohn's disease, pancreatitis, some intestinal obstructions, and appendicitis. So how does it affect nutrition? So we get indigestion and food intolerance. You have loss of appetite, so we don't want to eat anymore. We get constipation or diarrhea. We get difficulty swallowing our food, which is also a concern because we don't want to choking on food, right? And also malnutrition and dehydration. And of course, who here is taking medications? So medications affect our nutrition too. We have side effects from there that causes dry mouth, constipation or diarrhea. You notice how much this thing is like showing up? So that's a main concern about our nutrition. So it causes nausea and vomiting as well. So when you're nauseous, when you vomit a lot, it doesn't make you feel like you have to eat or anything like that. Causes weakness, and of course fluid and electrolyte imbalances. So when these things happen, it kind of increases your the likelihood that you'll be in a hospital and admitted just to kind of fix any of these symptoms.
So why nutrition is important? Nutritional status influence your body as a fighter against a disease. So if you eat more, you eat adequate nutrition, your body is a better fighter. And it also helps you maintain normal body function. You are able to walk your dog, do laundry, do housekeeping, and also you can think clearly. And also nutrition provide you energy to engage in the social activity. And in other way, if you're malnutrition, it reduces your mobility. You will have a low mood. You will be not happy, and you will have weight loss. You have reduced in energy. You won't feel like doing anything. Like you have no energy to do whatever you feel like doing it. And also it causes you reduce your strength, your muscles, which in turn increase the risk of falls and increase risk of fractures. That's in turn increase your stay in the hospital. So all this add up to reduce independence. So you need more independence on others. So to prevent this, the frequent nutritional screening is needed. Okay, dehydration is also is also very important. Dehydration can be life-threatening. It can lead to weakness, urinary infections, kidney injuries, low blood pressures, increased falls, constipation, and you have really a nasty taste in your mouth. And that's why the benefit of staying hydrated would be you have like better mood, and you prevent headaches, better digestions. You have like better energy to do stuff, and better kidney functions.
Okay, so now we are going to do a little active learning activity to help you understand what you should and shouldn't eat, to help you know what you should intake every day. So Nikki is going to pass out a picture that has the empty food plate, which is this. I want you to take the magazines that we provided for you and cut out pictures of foods and drinks, and I want you to put them in the spots where you think they're going to be. So if you cut out a glass of milk, I want you to think, is it a grain, dairy, protein, vegetable, healthy oil, or fruit? Or is it a liquid? Can it go in more than one place? We're going to give you a few minutes to do this, and then we're going to go over it. Okay, we are now going to go over it. So I have one done. And so I have stuff in every spot. So the first one we're going to do is fruits. In this case, it says whole fruits are rich in important nutrients and fibers. You should choose fruits with deep colored flesh. If you have canned fruits, they need to be packed in their own juice or low sodium. And you should eat about 5 or 6 servings daily. So in my picture, I have strawberries, peaches, oranges, bananas, grapes, watermelon. And so then the next one is vegetables. And again, you should pick ones that are darker green or with lots of vibrant colors. They are again for nutrients and fiber. And you should have 5 or 6 servings of these daily too. So in my picture, we have corn, carrots, spinach, lettuce, green beans, and peas. Then the middle is actually healthy oils. They are liquid vegetable oils and soft margarines, provide important fatty acids and some fat-soluble vitamins that are necessary in our bodies. And they should be 5 or 6 teaspoons daily. And I actually did not post any pictures on this one because it is vegetable oils and margarines, what you think they are on this part. The next one we're going to go to is we're going to go to grains. So whole grains and fortified foods are good sources of fiber and vitamin B. You should eat about 5 to 6 ounces daily. So we have bread, rice, pasta, and oatmeal in our picture. Then we have dairy, which provides protein, calcium, and some other important nutrients to help with bone growth. You should eat or drink about 5 cups daily. So we have milk, yogurt, and cheese. Then we have protein, and it's important for wound healing and repair. And you can have a variety each day. You should have about 1 gram per kilogram of body weight. So you have chicken, pork, beef, goat. Actually, nuts have a lot of protein too. So there's many different ways you can get your protein. And then liquids. You can actually get your liquids from food along with drinks, but you need to drink even if you don't feel thirsty. And it can come from many different places, but you should have 11 to 15 8-ounce glasses daily. And that can include coffee, tea, water, soups. The hydration that comes from vegetables and fruits can be included in that also. And then the other important thing to remember is mouth health. If you don't have good mouth health, it makes it harder to eat any of these foods. So you need to make sure you're brushing your teeth and taking care of your dentures. And there's our reference page.
You guys have any questions?
Okay. Thank you very much.
How many minutes was that?